Imagine you're being held hostage at gunpoint. Your life is completely in the hands of someone else. Perhaps it's even someone you don't even know. You're terrified, you're alone, and you have no idea if you will ever see your family or loved ones again. Maybe your captor talks to you softly or calmly. Maybe they offer you food or water. Maybe they tell you that everything's going to be okay. Perhaps they may even promise you that no harm will come to you. Suddenly, your brain goes into survival mode, where it does any and everything it can to make it out of this situation and be okay. Instead of seeing your captor as a threat or someone who's causing you harm, you begin to see them as someone who's helping you get through this. As unbelievable as this sounds, a psychological shift has occurred. This contradictory response is known as Stockholm Syndrome. Stockholm Syndrome is a psychological coping mechanism where a person begins to develop positive feelings towards their abuser. I have researched Sundrum's overview in EBSCO's Research Starters, PsyWellPath's Diagnostic Criteria, and the Cleveland Clinic's medically reviewed explanation of symptoms and treatments. Today, I'm going to be covering what Stockholm Syndrome is, the process to a diagnosis, and what treatment options are available for those struggling. To start, I'm going to explain what exactly Stockholm Syndrome is. Stockholm Syndrome is a stress-induced coping mechanism where hostages or victims begin to develop a positive, pleasant affection or even a sense of protectiveness towards those who are causing them harm. This is a direct contradiction to what you and I would perceive as a logical response. These people are a threat. They are putting you in a dangerous situation. But those who are being held captive don't see it that way. Their brain can't think of it that way due to the amount of stress and danger that they are in. This term originated after the 1973 Stockholm bank robbery, where hostages began to defend and protect the bank robbers, even from law enforcement. Sundrum explains that this response can help victims manage with the extreme fear and uncertainty that they're facing in the situation. To them, forming emotional bonds feels safer than resisting whatever they are being asked or forced to do. Now that we know what Stockholm Syndrome is, let's discuss how it's diagnosed. Due to the circumstances surrounding Stockholm Syndrome, there's not a clear route or path toward a diagnosis. PsyWellPath's glossary on diagnosing Stockholm Syndrome explains that there are no standardized diagnostic criteria. Stockholm Syndrome isn't even officially recognized on DSM-5, which is the reference manual published by the American Psychiatric Association. The DSM-5 provides standardized criteria for diagnosing all mental disorders. PsyWellPath's glossary also states that Stockholm Syndrome often typically overlaps with trauma bonding, post-traumatic stress disorder, commonly known as PTSD, and acute trauma response. Each of these factors is what makes a diagnosis so challenging. Common symptoms include positive feelings toward their abuser, negative feelings towards law enforcement, defending or rationalizing a captor's behavior, and difficulty leaving a captor even when the opportunity to escape presents itself. Because symptoms vary so drastically, clinicians typically focus on a victim's trauma history, their behavioral patterns, and their emotional responses as opposed to a traditional checklist. After learning the process behind a diagnosis, let's pivot to some treatment options. The Cleveland Clinic explains that treatment focuses on addressing trauma rather than treating Stockholm Syndrome as a standalone disorder. Psychotherapy is typically the primary approach. Cognitive behavioral therapy, also known as CBT, helps victims challenge the distorted beliefs about their captor. Trauma-focused therapy can help victims process the intense manipulation, fear, and codependency. Support groups allow survivors to have a safe place to share stories and experiences and work through what they're dealing with together. with the support of someone who's going through the same thing as you. Medication has also been proven effective in treating a number of symptoms. Some of these include insomnia, anxiety, and depression. The path to recovery is typically quite slow and can cause victims to feel shame, guilt, and confusion. They can even still feel a sense of loyalty toward their captor even months after they escape. The Cleveland Clinic emphasizes that healing requires a safe place, professional support, but most importantly, patience. Having explored the treatment options available, let us now review all that we have discussed. Stockholm Syndrome is a very complex psychological response that is molded and crafted by trauma, fear, and survival instincts. It may be a rare condition, but it is a phenomenon that must be understood in order to help those who are struggling. We have explored what Stockholm Syndrome is, how it's diagnosed, and what treatment options are available for survivors. Being able to understand each and every specific aspect of this condition is what helps us to better support these trauma survivors, and it incredibly is useful in helping us realize just how powerful the human brain can be when put in an intense and extreme survival situation.